My name is Dean. I'm a person in long-term recovery, and this is Inside Addiction. My guest today is the program director for the Center for Problem Gambling in Albany, Bill Hill. Bill, welcome to the show.
Thank you, Dean.
Bill, so we're actually about a couple blocks away from a casino. We could hop on the highway and be at another casino or horse track within probably 45 minutes. Probably north, south, east, west. We could be at a casino within 3 hours. I was just in Connecticut last week, and there was a courtesy van that was more than happy to take me to my choice of either Foxwoods or Mohegan Sun and bring me back. Or we could pretty much just go down the block to the grocery store or bodega, get some scratch-off tickets. But we don't even have to do that, Bill. We can just pick up our phones, be in the comfort of our own home, hop on a laptop, and the accessibility to online gambling, scratch-off tickets, casinos, horse tracks, it goes on and on. So, problem gambling.
Well, those venues would be okay for Dean, because Dean is not a problem gambler. See, Dean can go in and make a bet and walk out. He could win and walk out. A person with a gambling disorder can't walk out, can't stop. Once they start, they can't stop.
So, is it about winning?
It's about gambling. Gambling is not about money. Gambling is about the action. The next one, the next bet.
So it's never enough. There's not a finish line.
Never a finish line. I'm going to speak to you today, Dean, at a very pedestrian level, not an academic level, because I treat problem gamblers. And so I have a first-hand pedestrian view of what gambling is about.
So you're going to tell us what people say to you.
Yes.
Not what people write about.
No. The people that I work with tell me stories of winning thousands of dollars, but being unable to walk out of the casino, being unable to stop. They don't win. There may be an instance where they may win, but they'll come back the next day and lose it all.
So let me ask you a question. You know, Powerball was $700 million not too long ago. Mm-hmm. I figured I could lose just as good as anybody else. And, I thought to myself, hey, look at all the people that I could help. You and I could build the biggest treatment center and help a whole bunch of people. But obviously, we're sitting here in the studio, not a beach, so I didn't win. Mm-hmm. And I won't buy a lottery ticket probably until it goes up to $700 million again. Mm-hmm. But does someone need to spend hundreds or thousands of dollars to be a problem gambler?
It's the behavior, the chasing. Once I start, I'll chase until I'm out of money. There's never enough. We've heard that before in the substance use disorders, okay? There's never enough. When they borrow money from relatives, when they borrow money from friends, when their major life role functions are interfered with. There are two types of gamblers. One is a persistent gambler who gambles every day, and one is an episodic gambler. Now, the difference is, and I'm going to bring you back to substance use for a minute. So my uncle drinks once a year, gets in a fight, gets locked up, but he's not an alcoholic, right? Because when he drinks once a year, yeah, he is, because it brings about so much destruction.
Every time he does, this happens.
Yes. So that's the episodic gambler. The problem with gambling is that it has become so normalized, that is missed in diagnoses of our mental health facilities and our substance treatment facilities. We have people who have co-occurring gambling disorders that are not being treated. And what I've learned in my tenure at the Center for Problem Gambling is that gambling interferes with recovery. significantly because you still have the same lifestyle problems. Well, I'm not drinking, but I'm living in my car at the casino because I can't stop. Now, you mentioned when we were first started that you've been to AA meetings and NA meetings.
Yeah, I go to mutual aid sober support
Right.
meetings, and you know, there's a cake and there's a celebration, and somebody's
It's
got
a-
5-10 years, and there's all that scratch off dust on the table of the basement church because they're sitting there with $40 worth of scratch off tickets.
Sure, that's a problem.
That's just a replacement.
Yes, because see, what people have to understand, gambling has the same effect on the brain as substances. It messes with the ability to make decisions. It's a frontal lobe problem, okay? That message that says, you lost doing this last time, stop, never gets to that area of the brain. So they keep on. And that's substances too. It's not a minor addiction, it's a very major addiction because gambling has the highest suicide rate of all addictions. And I think the ratio that we've been most accustomed with is 5 to 1. I think that's low because what is not being reported are the vehicular accidents that are just attributed to someone running off the road. I've been at the Center for Problem Gambling close to 5 years. Not one person has failed to tell me at some point in time they wanted to take their life. At some point in time. I just admitted a patient the other day who told me a deer saved his life. Okay.
I gotta hear this.
You got to hear this?
I have to hear it.
Okay.
Continue.
He was on the bike trail in Troy, had the rope around his neck hanging off a tree, and he saw a deer. And he was throwing a rock at the deer for the deer to go.
Leave me alone.
Yeah, and the deer wouldn't go. And he terminated the suicide episode. But this is not an unusual story.
Wow.
This is not an unusual story. I hear this every day. Every day. And see, with substances, if a person consumed a fifth of the liquor and walked in here, you would say, oh, Bill, this guy is inebriated.
Yeah.
But if I'm a problem gambler, I could have just blown my whole retirement and walked and sit down and talk to you. Hi, Dean.
Well, that's it. You hear about, you know, the opiate epidemic, and we've seen, you know, what, for example, meth does to people, and there are those outward symptoms and signs and appearance. We can visibly see a lot of times when someone is under the influence.
Right.
So that's a great point. So, you know, what are some symptoms and signs? Is how does somebody know that somebody just blew the retirement, as opposed to if they're an alcoholic and they walk in, they're stumbling, slurring their speech?
By certain reports, because what we get is the same thing we get in substance use disorders. High anxiety, depression, difficulty with sexual functions, difficulty with elimination functions, difficulty with sleep and rest patterns, recreations, isolation. See, gambling is a disorder that separates a person from everybody else. It's a solo addiction. With substances, we go out, we meet people, where is it at, this and that. Gamblers like to be by themselves. The story I constantly hear from gamblers is, I'm with my family physically, but emotionally I'm never there. But emotionally, I'm never there. I'm always on the next bet. I had a story from a gentleman whose wife was pregnant. And waiting for the delivery, he had to go out and bet.
Wow.
He wasn't there. He wasn't there. And that's the story I hear most of all when we move to recovery from gambling. I'm here now, Bill. I'm present. This gentleman went to Florida for his vacation, and he came back and told me like he discovered Florida. See, gambling cuts you off from all reality. You create your own reality in gambling. just like other addictions. You
Right.
create your own. So it cuts off other things because gambling is a very jealous addiction. It only lets you focus on the gambling behavior.
What do people gamble on?
Anything.
What do you mean anything?
Anything. If we were standing outside now, Dean and I would be talking. If I was a problem gambler, I would be betting how many birds are in the sky, how many people walk past. It's an ongoing thing. The differences between gambling and the substance use disorders, with substance use disorders, the triggers and cues are more vivid. With gamblers, it's life.
Can't get away from it.
Can't get away. Can I make this red light? Okay. So it's always kicking off that addictive pathway in the brain all the time.
What are some of the stories you've heard as far as how people you've worked with have gotten into gambling and then how it's become problem gambling? Like the progression?
Well, the first thing that needs to be said, that's why the reason why gambling is so destructive, because it allows to progress for such a long time. By the time individuals get to my program, they have gambled 10 to 15 years without any intervention. So can you imagine someone on opioids going 15 years without any intervention? No, you can't. So when they get to my program, they are a severe gambler, okay, severe, all right, very, very severe. What was your question? I'm sort of got off track.
The progression.
The progression.
How do people,
Family.
what makes somebody go from just being a gambler to a problem gambler?
Okay. Well, let's go the initiation. This is I've seen my family do it. Okay, I've seen my neighborhood do it. Okay, and you know that just like in substance use disorders, if I continue to use a substance, I'll get addicted. If I continue to gamble, I become a very severe gambling addict. Okay, so I'm just gambling, and after a while, I just gamble to gamble.
And it's not even as a source of income.
No, that's a myth. I talked to some people who developed their logarithms for the the slots in the casino. And this is verbatim. We developed the mathematics for the slots to move a person from gamble to win to just gamble to gamble. Okay, so I've got people sitting in the casinos who have to wear Depends because they can't get up.
Because they might
Just can't get.
stay there just longer.
Yeah, they can't get up. And these are no extraordinary stories, I'm telling you. This is what I hear every day.
Wow.
Every day.
Why don't we hear about it?
Well,
'Cause there's certainly all kinds of, coverage on opioids right now, overdose deaths. You can't turn the news on any day. It seems like open up the newspaper.
because gambling has become so normalized and is not viewed as a serious addiction. Everybody does it. The only thing you have to do is stop. And when my clients tell me that's what's been told to them, they said, they laugh. So I can't stop.
Just stop.
Yeah, I can't stop. It's not viewed as a serious addiction. It's been so normalized and it's commercialized so much. Okay? And, one of the things we struggled with earlier with the substance use disorders is conveying to people that you're not bad people. You're just caught up in an addiction. You're caught up in a brain disorder. And that's the first thing I have to educate my patients on. You have a brain disorder. It's no joke. You're not putting any substances in your body, but you have a brain disorder. Just like you were using alcohol, crack cocaine, heroin, it's the same thing that's happening in your brain. Okay? Recovery is possible. And that's a beautiful thing when we see recovery.
Tell me about the relapse rates in like alcoholics, any other substance use disorder, the process
Okay.
of recovery for someone that's a problem gambler.
The treatment episode has to be longer.
Okay.
Now we have to get away, especially when we deal with gambling treatment, from the 3-month, 6-month thing. No, doesn't work. Okay. Gamblers need a prolonged treatment. The research supports me on that. One of the things that we found out in our setting, the longer we keep people, the more positive effect on recovery. And I think the sort of optimal time for formal treatment is about 2 years.
Wow.
Because once the person stops gambling, then they have to live life without gambling, which is troublesome. And when a person stops gambling, they have the same post-acute withdrawal symptoms as substances. In fact, we've had to hospitalize people who have stopped gambling.
For
Vital sign problems.
wow.
Yeah, Dean, this is a very serious addiction. This is no joke. Okay, and I go around to treatment places, mental health places, and I talk to counselors who we thought should know about gambling. They have no idea what I'm talking about. They have gambling? Is that bad? Yeah. So we need a longer treatment episode. See, I'm going to try to be politically correct when I say.
You don't have to.
Okay. Gamblers need a recovery community to support each other. So they need individual and group.
Gotcha.
They need individual and group. And in the group, you've got to create a recovery community to support it. And we've done some fantastic things at the Center for Problem Gambling. And basically, the patients told us how to do it. We created a thread where they have they can contact each other daily, anytime, using an app.
So it's a support network.
Yes, yeah, and as soon as the person comes in, we have them put the app on their phone. So at 8 o'clock at night, call whether you're feeling good or bad.
Right.
Just get in the habit of calling. Okay. We have a email that they can communicate with. We've created a client advisory board because I had no experience with gambling before I became program director and counselor. So basically, they told me what this was about and developed the program based on what they told me. And we've been pretty good at what we do, real good. Recovery process is difficult. You expect a lot of stumbles, but our thing is we don't discharge people. So I think that's the most ridiculous thing in the world, to discharge a person who starts to exhibit the same reason you admit them for. It's
like kicking somebody out of an oncology department when their cancer comes back.
Right. So we keep people, and we tell people to tell us the truth. If you gamble, come back tonight. If you gamble tonight, come back tomorrow morning.
Right.
Okay? And we use some 12-step principles. It's not a 12-step program, but we do. The honesty, open-mindedness, and willingness. Telling yourself, tell your truth. Very important. And the reason why the recovery community is so important is Because, and this is what I hear from all of our gamblers, we couldn't talk to anybody about this. They had no idea what we were talking about. Now I'm in a place where people know what I'm talking about. Okay? And that's what the recovery community does. That fellowshipping will do for people.
What got you interested in the treatment of problem gambling?
I was tricked into it. No. I'm also adjunct professor in human services at Springfield College. And I had retired in 2012. And a friend of mine who was working at the center asked me would I like to do some counseling there. I said, sure, that'd be interesting, because I've treated all kinds of clients. And I said, sure. And it took me a year, Dean, to start to conceptualize what I was seeing. Because you and we're used to seeing people's behavior after they put something in their body.
Exactly.
But no, I'm seeing the same behavior without any type of intake of substances. Took me a year to say, oh, that's what it looks like. Okay. So a good year of observation really got me really hooked into advocating for this group. Hard. They need it. Okay.
What do you think it is that people don't understand about problem gambling?
The seriousness of it, that it is a real addiction. There needs to be more focus on treatment by providers, not only program providers, but individual therapists. They need to get educated on the nuances of working with this population. I've been trained to treat gambling, but I really didn't understand the nuances of treating gamblers until I had hands-on experience. Okay, I could sit here and explain to you, but I didn't get it. Okay, I was first trained to deal with gamblers, I think, in 2007. And the person who trained me from an academic perspective. Okay. And right now at the center, we've created a gambling education program where we try to get across that barrier and bring what the problem gambler really looks like, what the person really needs. In our program, we're the only program in upstate that only treats problem gambling alone. We do nothing else but that. We've been doing that for 20 years.
Wow.
And one of the things one wrinkle that we put into our program, we've added recovery coaches for gambling. We developed training for gambling recovery coaches. It's a different ball game, all right? So we're very happy about that. And the recovery coaches that we have are people in recovery from gambling. So they know. They know.
What kind of people end up as problem gamblers? Like different backgrounds. What are some of the people that you've worked with?
PhDs, doctors, professors, people with substance use disorders, garden variety people, business people, lawyers, policemen. Okay. No one's exempt.
What are some of the risk and protective factors?
From a recovery perspective, well, the risk factors is money management. I'm dealing with people who have gambled away millions of dollars. And who are you, Bill, to tell me how to manage my money? Okay. So that's a big, having money is risky. Obviously, you're here sitting in my program, you can't handle money.
Yeah.
Okay, that's obvious.
You
thing.
earned your way in that seat.
Yeah, you earned your way in that seat. So, access to money, access to financials. And that's the first big hurdle that we have. How to manage your money. The factors, the supportive factors, is that we have to get the entire family involved. Have to get the entire family. We are much more successful when we have the entire family involved. What we've done is create a significant other treatment program. All right, because most of the time, the majority of the time, the significant other doesn't understand what really happened. Okay, and what do significant others do? Blame themselves. So our significant other program dwells on how to heal yourself. This guy may not stop gambling, but you got to heal yourself. So the family involvement is so very important.
So, Bill, we've got about a minute left. That is your close-up camera there. If someone's watching and is questioning that they may or may not be a problem gambler, or someone's watching and they're questioning that someone that they know may or may not be a problem gambler, what advice would you say to them?
Call the Center for Problem Gambling as soon as you can. Ask for Kelly. She's our intake coordinator, and we can set up an appointment for you in 1 day. We have 1-day admissions. So if you call us up and ask for an appointment at 9 o'clock, you can be in services by 6 o'clock that afternoon. So call.
Bill, thank you so much.
Thank you, Dean. Appreciate it.